Hi,
Hi,
I'm Smriti Khanna,
I'm Mahesh Menon.
and welcome to another episode of the Living Well podcast. Today, on our podcast, we have a wonderful lady who has been my mentor. Her name is Dr. Armida Fernandez. Dr. Armida, can we ask you to just tell us a little bit about yourself?
Okay, I'm basically a pediatrician. I did my MD at KEM, then moved fortunately to Sion Hospital for 3 decades. And I think after that, I followed what deeply moved me in my life. So I never stayed in one place. I moved from one to another. So the first thing is because the neonatal mortality was very high at Sion Hospital, the head of the department, Dr. Athavale, said, I said, sir, look at the babies dying. He said, why don't you do something about it? So then I just moved into neonatology.
Neonatology.
And after that, I spent all my time trying to reduce the deaths of newborns and at low cost because Sion Hospital is a municipal hospital. At that time, there was no money, there was no equipment, there were no nurses, but there were babies dying. And I had to save it. So that was my major thing. And in the process of saving babies at low cost, I realized those are two things that really helped save lives. There are many things, but one of it was the cost effective was breastfeeding. And once I found that out, I made sure that every baby in Sion was breastfed, and then we started the movement across not only the municipal hospitals, but across the city and across the state and across the country of, promoting breastfeeding. So that was a thing because that's what I felt strongly about, and to make sure every baby gets human milk 24 hours. Of course, then I started, as you know, the first human milk bank.
The milk bank. Yeah.
1989, long ago.
Wow.
But yes, that's 35 years ago. That's what I started, the first in Asia. And then from then, mortality was dropping. I was feeling great. But then I realized that many babies are at Sion Hospital, they're dying and the desperate and the poorest come. So there I realized that, these babies came and we tried to save many of them, but lots of morbidities when they went back. And I said, if they only came earlier, if they only delivered in the hospital, and then I realized I can't sit in the hospital and ensure that. And of course, the tipping point was one day a 6-week baby was raped and brought into that hospital. And at that time, I realized, I said, I can't keep sitting in this hospital. I need to go out and do. And I swore to God actually that day that I will move from the hospital into the communities. And that's, of course, the next story of my life, SNEHA.
That's SNEHA.
I started NGO that, it was 25 years ago, 2 days. 25 years.
25 years of SNEHA.
Wow.
2 years ago.
And SNEHA is now a how many people organization?
I started with one person. Now we are over 500.
Wow.
7,000 volunteers, lots from the slums. So it's big and across 7 municipal corporations, 9 I think, and 7 cities. So it's a huge thing.
Wonderful.
Metamorphized. And finally, of course, as you'll all know, 10 years ago I lost my child and now into palliative care. So I've just moved where my heart pulled me. That's what I did.
So I had introduced her once in a conference, and I said the ability to speak 2 words, the ability to kick a football, these were the abilities that I had acquired when she had already started her work in Sion Hospital. I was probably a couple of years old.
Yeah.
So they call them milestones in pediatrics. So these are the
Yeah.
milestones I had. And a lot of us who have seen you, and I had the privilege to see you as my dean when you were in Sion Hospital. And one of the things that we would have is we used to organize literary events and literature events, and we would say, who do we call as a judge? Na? Madam hai na? And we like, so, and she would show up for the show, and she had very insightful comments during our debates and so on. But if we summarize your this legacy of so many years, and it's been wonderful, like initiatives with children, initiatives with the milk bank. I remember walking in the corridors and hearing this concept of milk bank, and
Yeah.
There are things that people
Yeah.
wouldn't even have thought of. And then you work with SNEHA, which now you say that it has 500 members, 7,000 volunteers. How has that journey been, and how have you managed to overcome that difficult that dilemma of, or that
I think that
difficulty of how to
move.
work with the government,
That move from hospital to community is such a big one, which not too many doctors take, because it's tough. A hospital is such a
Protected, yeah.
safe, protective environment from us, and if you want to move into the community, there are so many things to look at, including the government. So,
Okay.
what made you think about
Yeah,
that,
the
and
switch.
what made you do it?
I'll tell you one thing. Most people say, look at the government, and they only look at the things that go wrong.
Yeah,
Now, I've worked with the system. I've worked with the municipal systems for 3 decades. And I know that, yes, they have their weaknesses, but of course they have their strengths. And there's
Yeah.
so many strengths that we don't look at. I also know within the systems that there is a ratio. In all systems, when you say things don't work, people don't work, there are 30% of people that may not work at all. There are 30% that are fencers. Work sometimes don't work 9 to 4 and not. But let me tell you, 40% of people want to do something good. And I think there are enough percentage of people within the systems to
Yeah.
work. And you must believe that. And I believe it because we've been able to do it. And therefore I said, how did I work with systems? Because, Mahesh, you cannot, if you want to do something in a country like ours with over a billion population, God knows what it is today, if you want to do that, if I work in the department of neonatology,
Yes.
I work just in a small part of Dharavi, how does it reach out? If you want to reach out what you're doing, you have to work with systems because they take it to scale.
Yes.
Take it across hospitals, across cities, to the villages, and across the country. So you need to work with the system and work with the system that works. And I think I've had the most wonderful experiences working with the systems. I must tell you, for example, I'll give you one example. I wanted to promote breastfeeding, and one thing when you're working with systems, I think two, three things you need. One is, if you have to convince them, you can't just say, I want to do this.
Yeah. Yeah.
You need to have data, something
Correct.
to convince them, not data what happened in some country in Australia with so many people or some part of Africa, data from our country to say you need that data to try to convince them. The second, you have the patience and perseverance of us. Say it doesn't happen overnight. It doesn't happen like this. Corporates, you decide, you have the money, you do it. No, government takes its own sweet time. So I'll tell you an example of what you can do if you can convince people. I told you I had this phase of saying that breastfeeding saves lives and I need to spread it. So I was at Sion Hospital, and fortunately I said, and let's do a baseline data of breastfeeding practices in our municipal hospitals. And there we showed that how people start breastfeeding in the hospital, then they stop, then they use formula, and then they give up very often.
So they
might
stop
continue.
when they go home.
Yeah, not stop. Just introduce something else.
So
The
like
baby
top
cries,
feed is-
top feed, and all.
Hmm.
Causes diarrhea, malnutrition, all
Hmm.
the problems with it. So we had that data. So when municipality was easy, I was working in it. I wanted to go to the government, and at that time the director of health services was Dr. Salunke. Didn't know him at all, but had the courage to walk into anybody's office, and I said, this is what I want to do. And he said, Madam, everybody in all mothers in India breastfeed. That was the impression.
That was
I'm
the
talking about
perception.
is 80s, long, long ago. I said, no, sir, and this is the data. He said, what? So many percent give up, so many people stop at. And he said, okay, you come with me. I'm going for a meeting where I'm meeting all the civil surgeons and all the directors, health system, Maharashtra. Come to Pune. Of course, I had to find my way to Pune, to wherever it was. And then he told these people, you tell them what. So I said, this is what we want to do. And he said, okay, we'll have a bottle breaking ceremony. Every hospital will have a bottle breaking
Wow.
ceremony.
Oh, wow. Did
You'll
you
have it
actually
in
do
the
that?
compound, yes,
Wow.
and send me photographs. So you know this. So you know what? If you convince them, and there are good people who want to do something, and then of course we train people across the state, and then of course the country.
So what was the reach of this activity that you did, the breastfeeding program?
You know what? Luckily, and also when you ever doing a program, you know you need funds. And fortunately, after I'd started the milk bank and all, I'd already become baby friendly. The UNICEF WHO 91
Yeah,
said,
yeah.
let's have baby friendly hospitals. You
Hospitals,
remember?
huh? Hmm.
So then they knew what I was doing. They came to me, and I said, of course, we'll take it across.
Hmm.
And then they funded it. So we had, made manuals and films and things like that, and we could take it across city, country. I think the blue manual of breastfeeding was taken with by UNICEF across the country. So
So
we did a
now
lot.
when you go to hospitals, you see so many of them say this is a baby friendly hospital.
Yes,
But
yeah.
probably in the 80s, this was
no,
not
no.
there.
No. It started only in 91, but we were there. And everybody, not me alone, everybody.
No, I understand. Like, there's a change in practice that you are
Yeah.
focusing on.
With the
And
help of systems.
with the help of systems, absolutely. And so that is what I said. If we fear the system, and if we think there's so many things that we need to deliver in healthcare, and we need the system to
You
help us out.
have to work it. In SNEHA, for example, now, in a small slum, how would we take it across? So in SNEHA, for example, we work with a municipal corporation, started a small referral system from Sion and other hospitals. Now we are across 9 municipal corporations all across the referral system, maternal newborn health. And so you're working with government ICDS. We're working on nutrition, and when it's ICDS, they have workers across.
Yeah,
So
yeah.
then you do training. For violence, we work with the police.
Hmm.
So we have done training program for thousands of policemen on violence. So you got to take them on board, and they will. There may be people who won't do it, but there are enough of people who can take
Who
it
will.
That's
forward.
very inspiring, because as you said, that there is so much good work that is also being done, and I believe it's time to also talk about the amazing work that we are doing despite all the restraints and constraints of our system.
I can't agree with you more. They're doing a phenomenal, and they try very hard. But there are numbers.
SNEHA works on women and children's health, their nutrition, violence,
And adolescent health as well.
and adolescent
So
health.
the life cycle. And now palliative care.
And now palliative care.
So
that
it's really
completes the life cycle.
Really completes the life cycle.
You've been here for a decade in palliative care, and what is your observation about the field? And of course, you come in from a personal experience point of view as well.
Yeah.
What has been your observation over the last decade or so, madam?
So I'll tell you what, Mahesh, what was my first experience? So where I'm talking about my daughter, you're an anesthetist, so I must tell you this. When she was being treated, I didn't know about palliative care at all. That was, over 10 years ago. I lost her 10 years ago. But there was, that institution had a pain management clinic run by the anesthetist. And therefore I was referred, and they said, whenever you get pain, get in touch with us and things like that. But I remember one day, my daughter had very severe pain, probably mets in the liver, sudden, I think the met. And she was yelling with pain. It's over about 5:36 in the evening. She was crying, yelling with pain. Mommy, do something about it. And then I said, let me call this pain doctor. And when I called her, she said, this is not the time to call me. I'm taking my children to the swimming pool. And, and my son-in-law said, what sort of a doctor are you who can't get anybody to relieve her of her pain? And I cannot forget that, because, today when we talk of palliative care, I don't think we allow people, any one of our patients
We try to do our best too, yeah.
Yeah, and at least we pick up the phone, we reply, we answer, there's someone else to take. So that is, and 10 years ago when I lost my daughter, I didn't know about palliative, and she suffered, and we suffered as well, so it was a tough time. So what has happened in this decade is, I would say that First of all, I didn't know very much. So if you ask me, did I know what all happened? But in my personal experience, say in
Yeah.
city of Mumbai, when I started palliative care, I only knew I first went to Tata's. I heard, oh my God, there is something like palliative care. There's an MD degree. So went to Tata's, Mary and Jyoti, all of them, Joita were there. And I started, talking to them about it. And then Firoza Palka, she had
Yeah.
already started her NGO.
Oh,
So
wow.
so I knew that I knew there's a hospital and I knew an NGO. But then, like I did in most of the programs that I did, I said, let's work together. No point in one, two people. So let's form a network. So that's why we said we'll start a network. But in those days, I think, Sriti, you'll remember you were there, yeah.
Yeah. The starting days of the palliative care
The,
network.
the
network.
Mumbai Palliative Care
Okay,
Network.
But you know what happened? Those days, we were a handful of people.
Yes.
May not be more than 10, 12. And I remember
Correct.
personally calling each one on the phone, saying, who is doing palliative care? Called you too also,
Yes,
Mahek?
I remember tea and biscuits also. So
So that we sort of called everybody. And then we formed this network.
Yeah.
We met together. And the whole idea is what can we do for palliative care together. But in these 10 years, what has happened, if you ask, I was just finding how many members do we have? We have more than some 16 organizations there
Yeah.
correct.
and over 110 members.
Yes.
So even the number of people who are into palliative care is a huge increase.
Yes.
The second thing I think in the decade that has happened is, even as we started with cancer,
Yes.
Shanti Vedana was there, always, and everybody's thought of. I think with more people working on non-cancer palliative care at all, I think there are many, many more people. So
Yeah.
that change I have definitely
Happened.
seen on that
Yeah.
day. But
Yeah.
then I also know because not personally, so I said I don't go around the country like I did for other things. But you look at even the Maharashtra network,
Yeah. Now that has also grown so
and
much.
every week there's a new person joining.
Yes.
That's so inspiring now.
It
to
is
see
good.
that.
Yeah,
It's
there are
good.
lots
It's like,
and lots of people. And now, we also know that if you want someone in Shimla who's doing palliative, there'll be always someone doing any part of the country. So
they will tell you.
obviously, palliative care. But having said that, I have my own sort of misgivings. Yes, it's sort of, like sparks flying here and there, we're spreading and all. Something that worries me is that uh, unlike what we've done in medicine, whatever we've been trained and all the way, there's no standardization. There are no systems, protocols into place.
Correct.
So when we say, okay, we've got new member joined, someone else has joined, I'm doing palliative care. Who can do palliative care really?
Yeah.
What are the qualifications?
Yeah. Yeah.
If I do an online certificate course, can I then practice
Is that
palliative
enough?
care? And where is that standardization? Normally, whatever we do, we have standards. We have to have someone we know. And if you're having standards and we don't have standards and we have no monitoring at all. So how really, what palliative care are we really doing? So it started over the decade. Yes, we have sown the seeds. It's started. It is growing, and it will grow. And it takes time.
And maybe it's one of the ways that a subspecialty grows also, no?
Yeah.
You initially start with people who have a little bit of experience, people who come in only with the wish of wanting to develop the field further. Like, for example, you came in with a pediatrician and a neonatology training, but you had that zeal in you that, okay, I have to get this ahead.
Yeah.
And then you take on whoever you find with you and train them along the way, on the way, which is, I think, how even Romila Palliative Care developed.
Yes.
And then along the way, we then start, okay, let's, which is what is happening now. No, Firoza has come up with a booklet on how home care should be done.
Yes.
Which is how then, and so then each of the partners kind of comes up with their own kind of standardization, and then we build it up into a larger.
I think that's a very good idea. But for me, I think I might have done it differently because, for example, when we did it for maternal unit, like maybe, but these are subjects well established. You can't compare the two.
Yeah.
And at that time, you can't do it alone.
Correct.
So what
Yeah.
we had done, so when we standardized protocols across hospitals, we got everybody together. We got people at the level of a health post, at a level maternity home, peripheral, and professors. We got organizations, we got IAP, we got
Yeah.
Moxie. So we had organizations, we got professors. So no one formed it. We all worked together. We worked together, then we standardized, and we looked at standards already existing, the WHO standards and all.
Correct.
So when you do it as a body, everybody coming together with people at all levels, giving it thought and all, I think that is the thing I'm looking at.
And I remember that every time in all our network meetings, this is what Madam used to keep focusing on. But I think that you have given order to that sort of initial rush and frenzy, because I remember going with you to health ministry.
Yes.
We all went.
Yeah, we were there.
Remember?
The
I
health
know.
ministry, and we done the
We done a lot of
lot
initial
of homework
meetings.
and done a lot of
So
presentations.
how did I know that you have worked a lot with the BMC and the government to do a lot of policies which were related to breastfeeding and neonatology? How did you do that with palliative care?
You know what? I may have started, Smriti, but I'm not happy with what has been done and how much has been done. Have you followed? So when we all went together, met them, talked to them, and there was, the National Health Mission has money for palliative care. So that's wonderful. Can you imagine our government? We have a directive for
Yes.
palliative care. There is money for palliative care. And therefore we had a training program. But this training program has not been done in a systematic way and covered the way we had.
The entire state.
And so we had some, then we didn't have
Yeah,
some, then
yeah.
someone else is coming and training them. So that hasn't happened. The other thing, if you really want to train, see, we are sitting in a city, we have all the facilities. What we had to do, which we did, first training we can have here, but the second training is we are there in their districts with them.
That effort
and
has to be made to reach the site.
reach the site, and you're an observer and let them train and you're listening. Have you followed? So today with online, I think we can do it, and there's a long way
We
to
can
go.
do it
We may
better.
have started it, but we're not done. And I think the people who are into training, we have too few. We need large numbers to get. We had huge numbers
Yeah.
to cover the
Yeah.
state. We don't have that in
See,
palliative care.
in the same breath, she's saying that if you have to work with the government, you need to give it time.
Yeah.
But you can see the impatience, and I think it's that sense
It's a
of impatience.
combination, of that
It's the
impatience
sense
that
of that
drives.
impatience which actually drives you, because I remember all these things that you have spoken about, talking with government, talking with already established organizations. So
Yes.
now, because of you, we were able to get the IAP, that's the Indian Academy of Pediatrics, the Indian Association
Yes.
of Pediatrics. Because of that, we were able to get IAP to agree to do
Certificate
modules
courses.
on
Pediatric palliative
pediatric
care.
palliative care.
Correct.
So I think this is the person to go to when you want to work with systems,
yeah.
all systems.
No,
Yeah,
but everybody can do it. But you have to have the patience, perseverance,
Yes.
and how to do it. And
So we are doing our bit. We are doing a podcast.
that's great. To tell you the truth, you're looking.
Is that the
Mahesh
right
as my
system?
student, Smriti, were joined as the first place you came. But I'm so proud of you all. I said, my God, you're doing such a fabulous. Besides this, I know what all you're doing in training. I'm really proud of you all.
Madam, no matter what, we're not going to edit this part out.
You don't, for heaven's sake, because this is, as a teacher and a person with grey hair and senior, I really mean that.
So,
I think.
You were my first mentor in palliative care, and Mahesh is saying that you are also his mentor.
Yeah.
and you have mentored him as the dean of Sion Hospital, whereas you have mentored me as from Romilla Palliative Care. So this is what I always notice when I go in a room full of pediatricians. There is no one who has never heard a lecture by
I know,
Dr.
God.
Armida,
Yeah, she
or
talks
never
too
been
much.
taught or never been taught by her. So what made you really want to go so much into education? I'm not sure if you deliberately decided to go into the field of education and mentoring, but what made you want to do it?
Yeah, and what's the role of the mentoring process in medicine? If there are people out there who are listening to us, and what can they understand about this part, madam?
No, and I'll tell you that I think I love to teach, first of all, and I think the best job you can have is to be a teacher. And you could be a KG teacher, you could be a college teacher, and you know what, you can influence the minds of so many people, because the teacher is really a role model,
Yeah.
and they are watching you all the time, you know, that they are watching you, and therefore what you do, what you say. And as a teacher, it's not just giving lectures in a class, because we come from a clinical ground, but when you walk, and therefore to all teachers, when you start taking that round of a patient, they are watching you, the way you greet the patient,
Yes.
the way you communicate with the patient, and you spend time and explain. And if you do it and your students are watching you, believe me, you'll have a different set of doctors. You're doing the right thing. You're bringing a different set of doctors into this world. And it's so, so, so important to mentor people. And I think that's what, when you say that, because I think, not because only I love teaching, but I loved babies. And I think what they say, what my students tell me, I always talk to my babies. And when this, that 800 grammar baby became 1000 grammar, I should say my Pila one. So, so, and how cute, you have to love what you do. But
Yeah.
I think that a role of a teacher, there's so many roles that you sort of to play. And I think when you want to teach, this is what I did in whatever I did. For example, when I decreased neonatal mortality in Sion Hospital, I said to myself, my God, I brought down mortality in Sion Hospital with 12,000 deliveries, so many patients. Everybody should be able to do it. So immediately I asked for permission, went across all municipal hospitals. That time, no money, nothing, nothing. And of course, municipality said, do what you want, don't ask for money. So with a projector, I had a little
Yes.
box
Yeah,
with their own
yeah.
projector. And then I went, and I couldn't afford it. So we went by train. My staff must have cursed me, but they came with me, went by train from to hospital, and made sure that we gave. And you know what? Again, when you teach, it's not just the doctor. When we taught neonatal breastfeeding, it's the administrator. They have to know what needs to be done, the doctor, nurse. So as a teacher, it's a duty, as one is to learn from your students. Yeah, I learned the most from my students, from both of you all also. And palliative care, I didn't know much. So you all came fresh and you were teaching. You learn from your students. But if you learn and you know what to do, then you need to spread what you do. And also, I think the role of a teacher is research. You
Yeah.
need data to show what you're doing. And therefore, it is so, I think, of course, there are lots of research happening in
It's
palliative care
happening. I
again.
think it's coming out now.
Yeah. And
So-
before we just go on to the last few questions of our podcast,
Uh,
I just want to say just an observation that when you mentioned that working with systems like the government, where we feel inherently there's a bias and we think, oh, it's going to be very difficult, and you said that there are great people out there. I also want to say that there are great people like you
my God.
in the system, who are inspiring, because we find that there is a shortage of role models to look up to, and we find that, but I think there are a lot of people like you in the system out there who are making things happen
Yeah.
every day, madam.
Yeah.
So,
Thank you,
I
thank you,
just,
Mahesh.
on behalf of all those people, I just want to thank you.
Oh, my, thank you. I'm feeling I'm going to say not made my day, week, month, whatever.
No, no,
Thank
no.
you.
So
Where was I?
yeah.
No, but that is something which is amazing. Every time I hear that story about her just taking that projector with one person
absolutely,
and
yeah.
going from one hospital to another training, I think maybe yes, you're right. That's what is missing for us in palliative care, especially if you're looking at training at each district, each village or community health center level. So hopefully we can get involved into that also. What we were discussing was research, and we
Yeah.
were saying that if it has just started 10 years ago, a lot of, I'm not saying that actually palliative care has started 10 years ago, it has started much longer
Yeah.
before, but there is a lot of research coming.
Going
So I
on.
think that
Correct.
people have taken up
Yes.
that mantle of, yes, we need to produce our own data, and that is all now coming out.
And we're talking evidence now. It's
Yeah,
not
yeah.
like
Everything
arbitrary,
is
and it's
evidence.
beautiful to see that happening, madam.
Yeah, and you need numbers also
Yeah,
when
yeah.
you say
Yes,
evidence.
To
because-
convince people.
And therefore, I think in research, one is that I think in certain areas where there's no much, I don't know how much research there's home-based care, we need to develop because we're in a country like India. You know, have a lot of research in hospitals, lot of research in OPDs.
Exactly.
You have
Yeah,
people
yeah.
there, but when you have
Yeah.
home care, and home care in different settings, you do home
Yeah.
care. For example, some people are from Goa. That when you can Kerala, Goa, different. They are cities, different cities. But you come to Bombay and you go through the slum to meet one patient. You need 2 hours to walk into the slum.
Yeah, it's
So
a world in itself, and there
So
are so
that
many
we-
small worlds there.
so we need to do research in all this and to show. And I also think what is missing in palliative care. Maybe you know, but I don't know. Collaborative research.
Yeah.
So if we
That's also
decide to
true.
do something, then everybody should come together. This is something that's missing in our palliative care. No? People from all over the country are not coming together. So I hope this will happen because
Yes, I see more of that happening. Actually,
Yeah.
we see more of that happening with the organizations that are coming up, the postgraduates who are coming up. There's a lot of crosstalk going on, and that those bridges are beginning to form themselves. And I think, and I am quite optimistic about it.
Yeah, definitely.
yeah, of course, give
But-
it time. Give it time.
So that's my next question. If there is somebody listening out there who wants to know, who has a passion, who wants to work with systems, who wants to work with the government, what would be the advice that you would give them?
What would I?
What would be the advice that you would give them?
So that if you know that what you're doing is right and you're convinced, do you have data to show what
Data?
you're doing? What you're doing. Second, you go. Third is go with people who know the system. Someone needs to introduce you. Someone whom the system trusts.
Correct.
You can't just drop down from heaven and say you come in and I'll accept. So you have to go through people, someone who you can trust, or convince people. Today, the political system also, if you want things to be shared, but here you go with someone who trusts, go with them, and they'll say, yes, I'll look through the paper, I'll meet you next week. So you talk to the secretary, when is he free, when can I? Nothing like, harassing them, persevering in them. And the time will come, really to be able to consult. And anytime you get a good person who can help you out, take them along with you and make sure. And go to the right people. Sometimes you have people who will not want to listen. You might have to wait till that person is transferred. I've had that experience. But
I'll just summarize these 5 points because I've been a good student. I'll say you need courage of your conviction.
Yes.
So you need the data.
Yes.
You need the right person.
Yeah.
You also need the right contact to reach the right person.
Yes, sir.
And then you need a lot of perseverance and just
Yes.
sticking to your...
Absolutely.
And you need the wrong person to be transferred.
And the wrong person.
It's wrong because they don't believe in what you're doing.
In what you're
They
doing.
they have different ideas.
Yeah.
This is not what I believe in.
But coming back to Romila Palliative Care, how does a NGO organization that does home-based palliative care free of cost, How does that work? Romila Palliative Care has now been working for 5 years?
The 7 years.
7 years.
It's not easy. Really. And it is not ideally the way I would have liked to work. And this is, I think, happens across whoever is working in palliative care and home-based care, and especially NGOs free service. First of all, we don't get enough doctors who are trained in palliative care.
Personnel. There's a issue with
Personnel
personnel.
shortage. And the second is personnel shortages. Today, the salaries that these doctors want is something not easy to get.
Not an NGO can.
For NGOs can't afford. That private sectors are different, but NGOs find it difficult. So a shortage of personnel, shortage of funds to pay them.
Do you think, I'll just pause there and ask you, do you think it would have been easy for an NGO to function, say, out of a city like in any other city, not Mumbai, where the cost of living is high? Do you think?
Yeah, probably it'll be better, easier. You don't have, out of Mumbai, even the salaries expectation is less,
Yeah.
because the
Okay.
cost of living is less. And people, if they have to come from out, they can get a place to live here. If someone comes from outside Mumbai, the cost of a place itself is
Yeah.
so
So
expensive.
the costs of running an NGO just related to the personnel is already high.
Extremely high. Then lack of personnel, that is the second.
Lack of personnel. Yeah.
Third is the personnel. You have doctors who are willing to work in hospitals.
Yeah.
If you say you work in the hospital, yes, we're willing, because we are trying to now work with hospitals. But if you say, are you willing home visits? Who wants to walk in the sun?
Yes.
Just recently, they walk and they may not get a place when you're walking in the slums to go to the toilet.
Yeah.
Where do you
So the
drink
real
water? Where do
practical
you...
issues of
Very.
community medicine
It is
challenges.
not.
Yeah.
So we need to have newer models of how will we do this, and we're toying with this in at Ramla Palliative Care. How can we change? How can we make it cost effective? My brain is all about cost effective solutions. Not easy, because you also need quality.
Yeah. Yes.
So although we started, but we have too many patients. We don't have enough staff. We're trying to ensure quality. We are trying to use, get nurses to work a little more, online consultation. So a whole lot of things, but not reached. But it'll go there. Like you say, you always start small. It is growing, and we will grow. And maybe in a few years, when you interview me in the next 10 years, in my 90s, I will be able to be in a better
Madam,
position.
I'm always inspired when we meet you. The way you're going on about the things that you're still wanting to do, it's so inspiring to see that.
So, on to our last question of the podcast.
Yeah, this is a two-parter actually, because we're going to have the first question is based on the name of the podcast. I'll go with the first one and I'll wait for Smriti to ask the second. My question is, what does living well mean to you from the pediatric palliative point of view?
So from the pediatrics, if I was a child, what is it I want? And if I was a child, I would want first love. I want to be loved. I want to be held. So I need that love, that I need living well. And then as I'm growing up, I know not only love of my parents, I need siblings. Of course, today is difficult, but friends and all whom I can play with and I can have fun with. So I need that sort of an environment. Of course, in a country like ours, when you're a child, also you want to eat. At least we have to say I need that food to eat and a safe place to live in as a child. So that's what I want, good companions, good friends. And as I grow older, I want to be able to play. I would say first play as a child. Secondly, laugh and have fun. And therefore, and maybe study if I have no choice and they make me. So I think that is, and I want to tell you, because you're saying what is it living well for? I'm sorry, stories, I've lived too long, I have too many stories to share. But you know what? When you're saying what do you want as a child, some 40 years ago when we had neonatal palliative care, I broke the rules, premature unit of the rules that existed. No entry into the... I got all the mothers into the premature unit, neonatal. And our mothers came, they held their babies, they breastfed them. Now we have this big kangaroo, but we were there already touching. And then I made them, the small little babies, suck at the breast. Today we have a big term, non-nutritive sucking.
Yeah.
But 40 years I had already started. And I feel those babies survived not because of our nurses and doctors. Nurses poking, sucking, pricking. Those are negative things. And today there's so much evidence that
So much
has
evidence about it.
long-term impact.
Yeah.
But they survived because at some time, of course, there was someone holding us.
them.
I want you to live. Nothing else. I
Skin to
love
skin.
you. I want you to live. And I think that goes into that baby wants it. And therefore, that's what would be living well for the child to me.
Yeah, that's powerful.
And what does living well mean to you?
Okay, at this stage of my life, what does if I was younger, maybe I would have said something different. But at this stage, I would say first is accept what has happened in life. No remorse. You have to get on in life. So whatever has come, whatever has happened and all, yes, it has happened. Accept it and move forward. That is one thing I would say that it is living well. Second is follow your heart. What you want to do, there's no tomorrow. Whatever you want to do it because your heart is telling that, and forget about it. Forget what anybody else will say. So follow your heart and do what you want. Third is you may be following your heart. You may not succeed. So what? You have not succeeded and all, but at least you have tried.
You've
So
tried.
you feel that you have that good feeling. Also feel that tell me living well is always planning that I won't be sitting around moping. So, for example, when I finished with neonatology, I'm so happy to hand it over to my to Jayashree, good person to hand it over, and then I was the dean. When I was the dean, my God, waiting to finish my dean course because I had to start SNEHA. I was going to the slums, I was longing, so happy. So there was always SNEHA. Of course, when I had to hand over SNEHA, that was a tough period when my daughter was ill, but I did. I got good people to hand it over, CEO. But then soon, in a few months, Holy Family asked me to come and join as director.
Yeah.
I took it up because I needed my mind going. And then when I was still in Holy Family, I was wanting to leave because then I started Ramla Palliative Care and all. So I think you have to make sure that, and you don't know what I'm doing now. I'm a call center. So I have things to do all along. And I think I'm living well. I love life.
That patient restlessness that you have.
Yeah. Yeah, that's a great way to
May not
put
be
it.
the best thing, but yes, it
Yeah.
is. I don't want to sit and look at the sea and concentrate. I can't do that. Meditate for hours.
I'll say it again. Very inspired to have you here on this and talk to you, madam.
Thank you so much. Thank you so
My
much for
pleasure.
coming on
So
the
proud of
podcast,
you.
madam.
And keep doing what you're doing. You're
Thank
doing a
you.
phenomenal job. Not here, but whatever you all do in palliative care as well.
You're doing a phenomenal job here. Also.
Not only here, I said, not only here.
Not here. Not this one. The real stuff that you do.
Great. Lovely,
Thank
lovely,
you.
lovely.
Thank you.
Lovely talking to you all.